Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Internal versus the external hemorrhoids. So first let's look at the internal hemorrhoids. So in terms of the internal hemorrhoids, it is located proximal to the dentate line. So it is proximal to the dentate line. And the next point is, it is covered by the transitional as well as the columnar epithelium. So this transitional as well as the columnar epithelium, and it is caused by the pressure on the superior rectal veins. So there is pressure on the SRV. SRV stands for the superior rectal veins. So let's write it. It is a rectal veins. And the internal hemorrhoids, it is painless. So the internal hemorrhoids, it remains painless. So there is no pain. It is painless and it can be ligated as well. Now when we look at the banding, it is preferred here. So banding is preferred in terms of the internal hemorrhoids. So this was the internal hemorrhoids. Next we look at the external hemorrhoids. So the external hemorrhoids, it is located distal to the dentate line. So internal was proximal and this is going to be distal. So it is distal to the dentate line. And how is it covered? So this is covered richly innervated by the squamous epithelium. So the external is by the squamous epithelium, internal we saw was transitional and the columnar. And it is caused by pressure on the, so in the external means there is pressure on the inferior rectal veins, IRVs, and the external is going to be very painful. It's going to be painful. So it is painful and it is not ligated. It is not ligated. And what about excision? Here the excision, if you see, it is done. So excision is done. To learn and grow daily like this, please do subscribe.